Hello, everyone. Welcome to my weekly Facebook Live. I apologize for last week. I was traveling at the time, and I thought that I was going to be able to pull off doing the Facebook Live while I was driving, and that did not go over so well. So I apologize for that. But now we're going to do the Facebook Live finally this week about cadmium toxicity. We're going to be talking about where you acquire cadmium, where in our environment you get cadmium, health issues caused by cadmium, and the best supplements to detox cadmium. Thank you so much for joining me. I apologize for last week. I thought I was going to be smart and do my Facebook Live in the car while I was driving, and the internet was not cooperating, so unfortunately I got cut off in the middle of doing the podcast. I want to start this week by, don't hesitate to leave me any of your comments or questions. I'm going to be answering all of your questions after I discuss cadmium toxicity and where you get it. So don't hesitate to ask any questions, leave a comment. I'm going to be answering all of your questions live on the air. So let's talk a little bit about cadmium and where you acquire cadmium. Cadmium occurs, or toxicity occurs, when high levels of it are accumulated in your body, whether it's through the ingestion of food or drink, inhalation, or direct exposure. And cadmium is involved in all the major diseases of our time, including cancer, diabetes, arthritic syndromes, heart disease, kidney disease, even depression, adrenal burnout, which leads to hormone disruption, and many, many others. And the Environmental Protection Agency has classified cadmium as a known carcinogen due to the dangerous effects it can have on human health. And in fact, cadmium causes more cancers than all of the other metals combined. So it's really one of the most toxic metals, and I think something that not a lot of people talk about in the detox world. Mercury is very popular, lead is very popular, but cadmium is a huge, huge threat to our health. And it's something that I find in the majority of my clients when they do the proper testing to discover cadmium. We don't typically see it on a hair or mineral analysis. And we don't typically see it on a urine test. We see it on a stool test. That's where we find cadmium. And every stool test that I've done has cadmium. People have some level of cadmium in their body. And so let's talk about cadmium toxicity. A mineral deficiency plays a role in contributing to cadmium toxicity. When one is nutritionally deficient in minerals like calcium, iron, and zinc, cadmium is absorbed by the body to fill in these nutritional gaps, where cadmium can occupy the same enzyme binding sites that zinc can, or iron, or calcium, and it replaces the deficient nutrients in these enzyme binding sites to keep the body running. And so over time, more cadmium is accumulated. So many people today are deficient in zinc, even if they eat lots of red meat and zinc-rich foods, because people have absorption issues today, from stress to EMF and other types of issues, other types of stressors. People aren't absorbing their food. They're not absorbing the supplements that they're taking. And it doesn't matter what you eat and what you supplement with. It only matters what you absorb. And toxic metals also replace other substances in tissue structures. So cadmium can be used to repair ligaments. It can be used to repair skin. And the replacement of cadmium instead of zinc weakens these tissues. So it weakens your arteries, your joints, your bones, your muscles. And this is why people can get aneurysms. That's why they can get hardened arteries. I think cadmium is one of the biggest contributors to heart disease, whereby the American Medical Association tells people to avoid eating red meat, and then they become zinc deficient. And then the body is forced to accumulate cadmium when it's exposed in the environment through the diet or supplements or the air, the water, wherever the cadmium toxicity or ingestion is occurring. And then the cadmium is used instead of zinc to repair arteries, and then the arteries become hardened and brittle. And then that contributes to high blood pressure because these arteries can't expand and contract like they would if zinc was being used to repair them. So zinc will leave the arteries very flexible, very pliable, and able to respond to increases in blood pressure, where your arteries will expand in response to higher blood pressure or stress response, and contract when you're relaxed. And that doesn't happen if your veins or your arteries are full of cadmium. And then when you get hardened arteries, that contributes to heart disease, hypertension, etc. That's why cadmium is a big contributor to heart disease. That's why smokers, tobacco is a huge way that cadmium gets into our bodies. That's why smokers tend to get heart disease. It's that cadmium hardening their arteries. And cadmium is also a very powerful stimulant to the adrenal glands, and it kind of irritates and boosts adrenal gland activity. The adrenals produce cortisol and adrenaline, but it does this in an unhealthy way that stimulants do, not in a healthful manner. And many people, in fact, want cigarettes and coffee and marijuana to give them their daily boost of cadmium to their adrenal glands. And so cadmium is one of the many stimulants in these substances. It's not just, say, the nicotine in the cigarettes or the caffeine in the coffee or the THC in the marijuana. It's also the cadmium that people crave because it gives them a little bit of a boost. So let's talk about where you get cadmium. First, I want to say hi to some of the people coming on. Thank you so much for joining me. Kathleen, hello from Seattle. Thank you so much for joining us. And Bridget Lamonte, my other half, is in Sparta, Wisconsin. So Blaze, thank you for joining us. So can cadmium come from chocolate? And how much chocolate would you have to eat? I'm not totally sure offhand if cadmium is in chocolate. I'm sure there can be some contamination of it if cadmium is in the soil or the water that the chocolate is irrigated by. So that's a possibility. Kathy, hi from Wisconsin. So everyone, thank you so much for joining us. Don't forget to leave me all of your comments and any questions you have about cadmium as we progress through the little lecture I have for you today. So where do you get cadmium? So cadmium poisoning has a vast variety of symptoms. It can affect a multitude of systems in the human body. And toxicity of this element is known to show its presence in the nervous system, the cardiovascular, digestive, endocrine, hormone, respiratory, excretory, and both the male and female reproductive systems. And it even affects our energy levels and the chemical makeup of our brain. And because of that, it can cause a lot of different, it can be found in a lot of different things, such as air pollution. So from the incineration of rubber tires, plastic, and paints, so when people are burning their trash, they're inhaling cadmium. It can be found in artist paints. So a lot of my clients that are artists, I find, do have unusual levels of metals that people who don't paint don't have. It can be found in auto exhaust, so we can be breathing that in. It's found in batteries and corroded batteries and dumps. I had one client, their family lived next to a battery factory, and their whole family was very, very, very cadmium toxic. It obviously had penetrated the soil and perhaps the water where the family was living, and they were cadmium toxic because they lived near this battery factory, which I found really interesting. Coal burning, so the burning of coal for fuel contributes mercury into our environment, which then settles in the ocean and gets into our fish. But that also releases cadmium into the air as well. Mercury is more popular, more people know about it, but cadmium is another consequence of fossil fuels, and cadmium also gets into our shellfish and large migratory fish as well. Ceramics, so again, anyone doing arts like ceramics or painting can get cadmium soaking in through their skin that are in the materials. Cigarettes and cigarette smoking, both tobacco and marijuana, contain very high levels of cadmium. So without fail, any of my clients that are smoking marijuana or vaping marijuana will have high cadmium levels on test. Anyone that has smoked at any point in their life, even if they were exposed to secondhand smoke as a child from a relative or parent that was smoking, are going to still be cadmium toxic decades later. And I've discovered this working with thousands of clients. You're not out of the woods just because you quit smoking, say 10 years ago. You still have to address the cadmium toxicity in your body that's residual from the habit of doing that. Coffee can also have cadmium. That doesn't mean stop drinking coffee. I love my coffee. I have a cup of coffee every single morning. And here, the reality is we just can't avoid all exposures in our environment. And so you're just breathing air, you're breathing in metals. So just because coffee or some, your artist paints contain cadmium doesn't mean you have to, live in a bubble and avoid all these different potential exposures. All foods and most waters will contain some level of metals or chemicals. You just need to be on a sensible detox plan and do something on a daily basis to detox. It's not about avoiding every single potential exposure. It's impossible. So drink your coffee, but just know you might be getting a little bit of cadmium in your coffee. You can get congenital intoxication where, the baby growing in utero in the mother, the baby is going to be absorbing any kind of toxins that are in the mother, including lead from the bones, mercury that might be in her nervous system, or other toxins. It's a reality of modern life. The toxins in the mother get passed to the baby. Contaminated drinking water is a big source of cadmium. Dental alloys, so mercury fillings, they're an amalgam that can contain cadmium. The alloy or the amalgams and alloys contain aluminum. They can have tin. They can have a number of different metals, including mercury. But mercury is not the only problem with mercury amalgam fillings. Cadmium can also be found in fertilizers and fungicides as well. Food grown in cadmium contaminated soil. And it's really interesting that most of the phosphate fertilizers are coming out of Morocco, and those phosphate fertilizers that are used to grow our food are very, very high in cadmium. So a lot of people are getting cadmium in their food, in their vegetables that they're eating, even if they're organic. So organic means chemical-free, pesticide-free. It does not mean metal-free. One of the reasons I think there isn't more testing on vegetables and foods for metals is because every food would have a warning label on it. Unfortunately, we live in an environment, say from leaded gasoline. We burned leaded gasoline for decades, and that released a ton of lead into the air, which then has settled into the soils, which now gets into our food. And you'll see a lot of Prop 65 warnings on many different supplements, especially food-based supplements, food and vegetable supplements, greens, powders, even modified citrus pectins like the Pectisol C that I recommend will have a Prop 65 warning label if it's sold in California. And the reason that is because there's so much lead in the soil. If any supplement or food even has a minute amount, a microscopic amount of lead in it, it will automatically get the Prop 65 warning. And I kind of think it's a political reason that happens, because Big Pharma wants to steer people away from natural supplements, from natural treatments, and instilling this Prop 65 warning label really is not something you find on Centrum supplements. It's really only on food-based supplements that are in greens powders that you're going to find this Prop 65 warning label, because everything has lead in it. All foods and vegetables have trace amounts of lead in them. It's very difficult to avoid that. So you need to be thinking about that when you're purchasing supplements. Certainly warning labels like the Prop 65 warning label are meant to protect consumers, but unfortunately I think it steers consumers away from natural healthful products as well. And so that's my take on it. I don't really put a ton of stock in the Prop 65 warning label. So cadmium can also be found in hydrogenated oils. So any kind of processed food, fast food, you're going to find these partially hydrogenated oils, these enteroesterified fats, where they have, there's cadmium and nickel in those foods. Margarines, avoid margarine at all costs. And so metals are going to be found in these very unhealthful oils. Instant coffees can also contain cadmium. I tend to recommend avoiding instant coffee. Large ocean fish like cod, tuna, and haddock. I just mentioned how mercury gets into our fish. Cadmium is also present in large ocean migratory fish and shellfish as well. You can get it in cadmium in pigments, plastics, processed and refined foods because it's in the partially hydrogenated oils. Refined grains, flours, and cereals, rubber carpet backing. Carpet tends to have a lot of volatile organic chemicals and metals that you'll breathe in, especially if they're new carpets. Sewage sludge and shellfish, Silver polish can have cadmium in it as well. Tap water is a big contaminant, and various industries where if you're working in manufacturing or welding of any type, you can definitely get a significant amount of cadmium and other metal exposure. So some of the symptoms associated with the cadmium toxicity, there's a lot. It's vast. And one of the problems when you're going to your mainstream medical doctor and you present with depression or poor sleep or abdominal pain or anemia or a lot of different symptoms that may be so-called subclinical in nature, they're not something that has a specific treatment for. The doctor may just give you some sleeping pills or some antidepressant medication, but there isn't really anything that's used to address the underlying root cause of these health issues. And what I find in working with clients is that once they start a detox program over the course of a few months, they find these vague symptoms fall away one by one by one, because they're actually addressing the underlying root cause, which they weren't able to do in going to their medical doctor, who simply gave them medications as a Band-Aid to cover up symptoms. And so some of these symptoms of cadmium toxicity can be mistaken for other illnesses and symptoms. So abdominal pain, aches and pains, alcoholism, even a lot of people that are in physical pain or have metal toxicity that is causing anxiety or depression will turn to alcohol and other substances to mask that pain. Alopecia or hair loss, anemia can be caused by cadmium, arteriosclerosis or hardening of the arteries, arthritis, bone pain, bone diseases, cavities and tooth deformities, hemorrhaging, because cadmium makes the arteries and the veins very, very weak. So people can get cerebral hemorrhages and aneurysms as a result of that. People can get hemorrhoids as well. That's just another sign of weak veins, weak arteries. Cirrhosis of the liver, cramps, depression, diabetes, diarrhea, digestive disturbances, emphysema, enlarged heart, flu-like symptoms like chills, muscle weakness, aches and pains, things like that, especially when breathing cadmium-polluted air, headaches, high cholesterol, high blood pressure. People can get high cholesterol, like I just mentioned, hyperlipidemia. They can get hypoglycemia, impaired bone healing. Men can experience impotence because of this. Women can experience infertility because cadmium increases the number of natural killer T cells in the body, and those have to be very, very low to allow a pregnancy to thrive and to grow. And many women that are experiencing recurrent miscarriages may in fact be cadmium toxic, that's raising their natural killer T cells and promoting recurrent miscarriages. Cadmium can also cause joint pain, kidney disease, learning disorders, liver damage, low energy, low sperm count, memory loss and brain fog, migraines, muscle weakness, nausea, nerve damage, prostate dysfunction, shortness of breath, smoker's cough. Anytime I have a client presenting with a chronic cough, like a chronic low-grade cough that doesn't go away, I automatically think cadmium toxicity. Schizophrenia as well, strokes, and swelling of the nose, pharynx, and larynx can be caused by chronically inhaling cadmium. Say if you're in a manufacturing or work environment where you're always inhaling cadmium, you can have irritated nasal passages, and nausea and vomiting can also be caused by cadmium. So that's a lot of different, it's a huge list of symptoms, but I want to go into some health conditions caused by cadmium. It affects so many different systems in the body. So cadmium can promote cancer, and it's usually associated with the development of different types of cancers. And the reason why is because when we have a cell that's attempting to divide, cadmium interferes in that cell division process where your DNA make a copy of the genetic material of the DNA. So when it doesn't copy properly, you get an aberrant cell, or you get a mutant cell. And if the immune system is otherwise occupied, if you're nutritionally deficient, or if you have a lot of different infections, you have multiple root canals, you have anything that it's overly taxing your immune system. You're under a lot of stress, not sleeping enough, doing a lot of stimulants, and, you know, places where people find themselves, you know, in their 40s, 50s, and 60s, and the primary ages when people develop cancer, it's because their immune system is too weak to kill off this aberrant cell, and then that aberrant cell, that mutant cell, is allowed to grow into a tumor unchecked. And that's the process whereby cadmium causes cancers. And that's why smokers tend to get cancer. So my father died from esophageal cancer. He smoked for 40 years, developed esophageal cancer, which is found primarily in smokers, men in their 50s and older. And it was the cadmium in the cigarettes that caused that. And your nervous system as well. Cadmium inhibits the release of acetylcholine and activates cholinesterase. And this results in a tendency for hyperactivity of the nervous system. Cadmium also damages nerve cells, so people can get neuropathy, numbness, tingling. Energy, cadmium causes strong inhibition of essential enzymes in the Krebs cycle. So your mitochondrial ATP production or energy production is dramatically affected by cadmium toxicity. And bones and joints. So cadmium alters calcium and phosphorus metabolism, and this contributes to arthritis, osteoporosis, osteopenia, and neuromuscular diseases. And the findings in one study conducted by the Division of Laboratory Medicine, Department of Toxicology at the Medical University of Silesia, showed that cadmium has both a direct and indirect toxic effect on the bones. And the cardiovascular system, I mentioned that cadmium replaces zinc in the arteries, contributing to brittle, inflexible arteries. In your digestive system, cadmium interferes in the production of digestive enzymes that require zinc. So your stomach acid, your hydrochloric acid requires zinc. Many digestive enzymes require zinc as well. So a lot of people that have poor digestion, it's actually because of cadmium toxicity interfering in a lot of the different digestive processes. And in the reproductive system, in men, low sperm counts, prostate problems, and impotence can result from cadmium-induced zinc deficiency. Zinc is required to produce testosterone. So if you're not eating red meat and you have cadmium toxicity and you're just not getting enough zinc in your diet, you can be prone to cadmium toxicity and the fertility issues as a result of that. And women are the same. Cadmium can cause fertility issues in women as well. And in the endocrine system, zinc is required for growth and insulin release. So cadmium can contribute to diabetes. I think cadmium is a big contributor to diabetes, and why we're seeing such a plethora of diabetes in so much of our population today. And the excretory system, cadmium affects the kidneys, resulting in high blood pressure and kidney disease. Again, I think cadmium builds up in the kidneys, mercury builds up in the kidneys, lead builds up in the kidneys, and that's why we're seeing a huge cause of kidney disease today. Lots of dialysis centers opening. There's franchises of dialysis centers opening all over the United States, and toxins are a big leading cause of that. Again, the medical doctors are not looking at that as toxic metals as the underlying root cause of these health issues. Psychologically, cadmium can be associated with learning disorders and hyperactivity. Children with ADHD and other types of hyperactive issues can be a result of cadmium toxicity. And immunity, I mentioned that metals like cadmium impair natural killer cells. And most of our white blood cells are called natural killer cells because they're specialized to kill certain types of disease cells, especially cells that have been infected with a virus or cells that have become cancerous. And if your natural killer T cells are too high or too low, this is really, really bad. Cadmium has shown to increase the number of natural killer immune cells, which, like I mentioned before, need to be low during pregnancy to allow a pregnancy to thrive. And so I think we went over enough of the health conditions. I have another massive list of health conditions that I can review. But I think we covered a lot in by going over all the health conditions that I've already listed. So why don't we go over some of your questions, and then I'll talk about how to detox cadmium, what are the best supplements to detox cadmium, and how we all go about that. So Bridget, we are all mutants now. Yeah, I agree with you. Unfortunately, because of the level of toxins in our environment, because of the level of metals and chemicals and glyphosate and other contaminants in our food, it's dramatically altered our DNA. It's altered our gut microbiome. You know, we need all of the different bacteria in our body to communicate to the cells of our body how to function. So a lot of information in our environment is collected by all the different microbiome in our gut, all the bacteria in our gut, and it's constantly monitoring the outside environment, monitoring the food that we eat, and then that information is transmitted to our cells. And unfortunately, because of many different toxic metals like mercury, which is an antibiotic, like colloidal silver, which is an antibiotic, and glyphosate, which was originally developed as an antibiotic, is killing off all of our good gut bacteria and reducing our body's ability to digest food and protect itself. It's and our immune system as well. Our gut-associated lymphatic tissue in our gut is very, very important for our immune system. And so unfortunately, because of all these toxins in our environment, we're dramatically altering our health, dramatically altering our genetics, our epigenetics, and that gets passed on. It's shown in new research that we have become mutants, where toxins we're exposed to today can be passed down 4 generations because of the genetic mutations that they cause. So you're correct in that we are mutants. So Blaze, so where is cadmium stored in the body? I actually have a chart where I can tell you that. Let me just find it here. So yeah, I have lots and lots and lots of different charts that tell me all the different organs where these metals are stored in our body. Let me just see if I can find it really quick here. It might take me too long to find this little chart. Oh, here it is, metal storage sites. So cadmium is stored in our bones. Cadmium is also stored in our kidneys, like I just mentioned before. It's stored in our liver, it's stored in our lungs, and it's also stored in our pancreas, which is why cadmium contributes to diabetes, chronic low-grade cough, hypertension, high blood pressure, because it affects the kidneys. And so luckily I have that chart handy to answer your question. So, so the next question here, Wendy, please speak slower. So sorry about that. I tend to get carried away. I get excited talking about this, so I'll try to speak slower. And yeah, so Ryan, yes, you can watch this replay over and over. If you missed something, the video will be available on the Myers Detox Facebook channel. You can watch it at any time. We also upload it to my YouTube channel, youtube.com/Wendy Myers, so you can watch it at any time. In the future, we're going to be doing a transcript of all the Facebook Lives. We're going to be, we're working on that right now on that project, and that'll be on MyersDetox.com coming soon, because we've had a lot of requests for the transcripts for these Facebook Lives. So Diane, hello from Austin. Thank you so much for joining us. And Bridget, Monsanto's Roundup equals glyphosate was an antibiotic. Yes, glyphosate was originally produced as an antibiotic, but then Monsanto discovered other uses for it, and they realized that it was a really potent weed killer, that it was an herbicide. And how it kills those weeds is it chelates all the minerals from the weed, and that's how it kills you. And that's also how glyphosate is slowly killing you. It chelates the minerals from your body. Our bodies are already mineral deficient from stress and EMF and nutrient deficient diets, nutrient deficient soils in which our food is grown. And glyphosate contributes to that mineral deficiency by chelating and grabbing minerals out of your body, especially manganese. Manganese, I find, is deficient in almost every single person that I've tested because of glyphosate contamination in our environment. And so glyphosate it even contaminates organic food. It's shown that about 7% of organic food does have glyphosate contamination if the organic farm is located next to a conventional farm where they're indiscriminately spraying the glyphosate from the air. They spray it with planes. And then if an organic farm is next door to that, that gets contaminated as well. So let's see. So one, yay for transcripts, and thank you for slowing down. And so Valerie, hey, love you. I need a camp. When can I come to your home this summer? Well, you'll be happy to learn that pretty soon I'm going to start doing a yearly live event. I've been planning this for a while. I've been wanting to do it for quite some time, where I'm going to pick a location, maybe in Malibu. I've thought about maybe doing it in Hawaii, where I am going to invite all of you guys on my email list. I'll send you guys an invite to come join me and spend a weekend with me talking all about detox, answering your questions, and just hanging out and having fun. So I will have a camp pretty soon for you to come to. So Kathy, which stool test and marker detects cadmium toxicity? So the only test that's really, really accurate at detecting cadmium toxicity is a stool test. I use Trace Elements International to do a stool test, and that's what I found is the best way to see cadmium. Because when I've tested clients, I've done a hair tissue mineral analysis, and I won't see any cadmium at all. I very rarely see cadmium on a hair mineral analysis. And then I'll do a urine test, and I'll still see very low levels of cadmium, not in the toxic range whatsoever. And then we do a stool test, and lo and behold, they have extremely high levels of cadmium. And I've seen this over and over and over. Dr. Chris Shade has the blood test. He has a trimercury test, but he also has a blood test for other metals. That one can see cadmium as well, but I don't think blood is the best way to detect metals, because the body has a protective mechanism. After you're exposed to a toxic metal, the body has to sequester those metals into your tissues to keep it from harming your vital organs. And so the body will store these metals in your ligaments, in your bones, in your muscles, in your nervous tissue, in your brain, in your fat, to keep it out of the blood, out of circulation. So the blood is really not a good way to detect metals unless you've had a recent acute exposure. And so if you go to the hospital, you've had a known exposure, they'll do a blood test and may very well find something, but they usually will get a false negative, where people do have a lot of very high levels of toxicity and metals in their body. It's just not showing in their blood. So the blood is not my go-to way, or not the way that I recommend to do testing for metals. So, Marina, I did a hair test and cadmium came up high. Yeah, so I'm not saying you'll never see cadmium in a hair mineral analysis. It's just I've done thousands of tests, and I find that typically people don't have it in the hair. But I have found that some people do, and that means they're usually incredibly toxic in cadmium because their body's pushing it out. Your body kind of uses your hair as a garbage can and will excrete certain toxins into the hair as an elimination method to remove them from the body. And I found that a lot of marijuana smokers, cigarette smokers will tend to have cadmium levels in the hair. When we know they have a high exposure, we'll typically see it on the hair test, but not always. So it's one way to test for it, but the most accurate way is a stool test. So Saul, does the Porphyrins test check for cadmium? Does a stool test require something to provoke cadmium to be removed? So no, a stool test does not require a provocation of any kind. Actually, a provocation will ruin the test. A urine does require provocation with DMSA or DMPS, but the stool test does not. So Ryan, so in case we don't get down to my earlier question, I've been doing various cleansing and detox, been concerned about my elimination channels, especially the kidneys and the liver and the lymph. Can you talk on this a bit? I want to make sure I am eliminating the waste, not recirculating it. So that's a very good question. People do have legitimate concerns about taxing their detox organs. But the name of the game in detox is you want to do it slowly and safely. So a way to not detox slowly and safely is doing IV chelation, where you do an IV, you inject some amino acids like DMSA or EDTA or DMPS into your body, and you rip all kinds of metals and minerals out of your body very, very quickly. That can damage the kidneys. So if you're doing that, say you have a life-threatening situation where you need to bring your metal levels down really, really quickly, that can be done safely if the doctor really knows what they're doing, but that's not my first go-to recommendation, because detox generally needs to be slow and safe to protect the detox organs like the kidney and the livers and the lymph. But if you're doing something on a daily basis, so if you've made detoxification more like a lifestyle, how I talk about doing detox, and it's something that you're committed to doing for life because we're constantly exposed to toxins and metals in our environment, then you don't really need to worry as much about harming the kidneys or the liver or the lymph. The number one thing you need to think about is keeping the bowels moving and taking binders. So as long as you're doing that, your detox organs will typically be safe. So I always recommend doing coffee enemas to keep the bowels moving, and also as a way to make the best way to mechanically detox the liver, kind of wring it out like a sponge. And that's really the best way to protect your kidneys and your liver. And by taking binders, you also absorb a lot of toxins that you're maybe mobilizing from tissue storage sites, mobilizing from your muscles and your nervous system. The binders, I typically recommend my new Citra Cleanse that has come out. It's in my store at myersdetox.com. That's my favorite binder. It's a modified citrus pectin that's incredibly effective at absorbing all kinds of metals and chemicals that you're excreting when you're doing a detox. Say you're taking supplements or you're doing an infrared sauna, whatever you're doing to do your detox, you always have to take a binder to absorb the toxins so they don't redistribute and land somewhere else and deposit somewhere else in your body. So that's the best way that I can recommend to protect your organs, is by taking a binder like my Citra Cleanse and doing coffee enemas. So Misty, thank you so much for joining us, Misty. It's so nice meeting you at the Bulletproof Conference. So how does one check detox pathways for functionality? So, it's a difficult question. I mean, you can certainly check your genetics. You can do a 23andMe and run your genes through different apps, like Sterling's app is one of my favorite ones. Dr. Ben Lynch has an app. But there isn't a lot of research on the detox genetic pathways. There's a few, there's some on your glutathione functioning and other types of detox functioning in your body, but it's really in its infancy. And the genetics, unfortunately, don't give us a tremendous amount of information about how your detox pathways are functioning. It gives you some, but it's not a complete picture. So it's limited, I think, in its value, but it does really help. I mean, for some people, if they're really far gone, they have multiple health diagnoses, their detox pathways certainly are going to be compromised, and they're going to have a reduced ability to detox their body. So with that type of client, I prefer to introduce them to doing our Nest Health Bioenergetic Program, because that's one of the best ways to, so to speak, clear detox pathways or to improve metabolic functioning overall in the body. It doesn't matter what it is, because your DNA throw off an energetic field. And so by correcting the body's energy field, which is the main way the body communicates, we're able to correct a lot of metabolic physical functioning in the body. So rather than try to do genetic testing and supplement around the different defects and genetic pathways, I think it's a much more effective route and simpler route and more intuitive route to do a Nest Health Bioenergetic Program and correct the issue at its source. And so typically it's an energetic issue where we have different energetic blocks in our body due to chemicals, toxins, emotional trauma, and other scars in our body, surgeries. These things cause energetic blocks in our body and hinder communication in our body. And then we eventually get a physical breakdown in functioning as well. So that's really one of the more effective ways that I think that people can correct their detox pathways and enhance their body's ability to detox. So that's my preferred way, and I find that it just works very elegantly, very beautifully. It's an easy protocol to do. People can do it in the comfort of their own home. And we put, probably between 500 to 800 people. I don't have a count right now, but in the, hundreds of people through our Nest Health Bioenergetic Program. And it's incredibly effective at addressing people's health issues and enhancing their ability to detox. So Adrian, thank you for joining us. So I'm doing a Quicksilver Mercury Cadmium Arsenic Detox with IMD, Intestinal Metal Detox by Quicksilver, protocol cube and feeling a thumb joint pain. Is this normal during detox? So my cadmium levels were the highest in my blood and high normal range. So yeah, so cadmium does cause joint pain. So cadmium is notorious for affecting the joints. There was even an outbreak in Japan called Ida disease, where people got severe joint pain. It was caused by cadmium toxicity. So that's normal. When you're doing a detox, you're going to have to deal with some uncomfortable symptoms, unfortunately. And so, for instance, when I was in the early stages of doing my detox, I was detoxing a ton of aluminum, getting really, really irritable. Some metals can cause you to have insomnia. Some metals will cause you to have indigestion, GI issues. Some metals will cause you to have anxiety and depression. And so cadmium, we know that causes joint pain. So it's not uncommon when that metal is coming out of tissue storage sites, it's going to cause an irritation and cause a flare-up or an intensification of the very symptoms that you're trying to get rid of. So don't be dismayed by that. What I recommend to people is try to push through if you can. Just try to deal with the symptoms as best you can. If it's too much, if it's too uncomfortable, it's hindering your ability to live your life or go to work, that's not what we want during a detox. You can address this in a number of ways. You can drink more water. You can take more binders. You can stop taking your supplements for a little while, give your body a little bit of a break. You can do coffee enemas. Those are amazing for eliminating pain and detox symptoms. I have an article on my website called How to Address Detox Symptoms. If you type in detox symptoms or healing reactions on myersdetox.com, you'll come to that article, and there'll be a huge list of ways that you can address detox symptoms to make it more comfortable. Taking binders while you're doing a detox is especially important. So you're taking the IMD, intestinal metal detox. You probably need to add something in addition to that, because the intestinal metal detox, it's a way to block in your intestines the absorption of lead, mercury, cadmium, and copper from your diet and prevent its recirculation and absorption into your body through your intestines and your liver. But what I find is that the CitraCleanse that I designed, it's a modified citrus pectin. It's in the store now. It's stored at myersdetox.com. That gets into your bloodstream. So not only is it in your intestines, but it also gets into your blood and absorbs all kinds of toxins. So I think you need a little bit different type of a binder in addition to the IMD to help reduce those symptoms. IMD is incredibly effective. I recommend it. I take it myself, but it's not the only binder by itself that I would recommend for that reason. So it's different binders have different functions in the body. So Ryan, so I've been going towards 2 years. So I've been going slow, but the kidneys I'm worried about maybe not filtering properly. Yeah, so you just have to keep at it, Ryan. 2 years is a very good chunk of time to be detoxing. So congratulations on sticking with it and, detoxing for that long. But the reality is that many people today, if they've lived 3, 4, 5, 6 decades, that's a long time to accumulate metals and chemicals. So for some people, depending on how toxic you are, how sick you are, it could take you longer. It could take you 5 years. Everyone is completely different in the time it takes to remove the majority of toxins in their bodies. Say the goal is to remove 80 to 90% of the toxins in your body, and that's going to take more time for some people. So just keep up the good work. Stay committed on the path to detox. Detox is a lifestyle. It's something that you add to your health regimen, just like eating healthy food, taking supplements, prioritizing sleep, and exercising. It's something you have to do in today's toxic environment to be healthy and to experience the health and the happiness and the energy levels that you deserve. That's very, very important. So Leslie, so does psyllium help detox metals, and if so, which metals? So psyllium, any type of fiber is going to detox metals. So cultures around the world that eat the largest amount of fiber, the largest amount of vegetables, have lower metals in their body. And this is why I don't typically recommend juice fasting to detox metals. Why? Because it has no fiber in it. You have to have fiber to bind onto metals and expel them from the body. That's why I have people on purpose take soluble fiber like my CitraCleanse modified citrus pectin. It's just a fiber. That's all it is. So psyllium is great. Psyllium is not something I would take long term. Do a little experiment. Take the psyllium, put it in some water, and then put a spoon in it. And you're going to find the psyllium turns into a brick. It becomes like really, really hard. And so that's not something you want on a daily basis to be ingesting, because that can cause intestinal blockages in some people. It can cause really serious reactions. So it's fine every once in a while. Say if you're going to get a series of colonics or something like that, it's fine every once in a while, but psyllium is not something to be taken on a daily basis. I would prefer you take something like my CitraCleanse or a modified citrus pectin or other type of binder if your aim is to detox heavy metals. So Kate, hi Wendy, you're great. If someone is dyeing their hair with natural products, will a hair analysis be accurate enough to be valid? Yes. So dyeing your hair does not affect a hair mineral analysis that I found. Most of my clients are women. Most of them are dyeing their hair. We all love to dye our hair. And I just haven't found that it affects the mineral or metal levels in the hair at all. The only exception is bleach. So if you're using peroxide or bleach to bleach your hair, especially at the roots, so the women that are doing the white bleach blonde, that will affect the results of a hair mineral analysis, but not if you're just doing the highlights. Those are fine because you'll just take the hair sample from the back of your head or somewhere where you're not doing the highlights. So I find that doing the hair mineral analysis and dyeing your hair are totally compatible. Don't see any issue there whatsoever. So Christine, so what are your views of using a suppository like EDTA overnight? So I'm a big fan of EDTA suppositories. I definitely recommended them to my clients that are cadmium toxic, because EDTA is a great way to bind onto cadmium and remove it from the body. So I'm a huge fan of those. I recommend Kelotox EDTA suppositories. And they're found in clinical trials. 3 of those a week are just as effective as 1 IV session chelation of EDTA, and much safer for the kidneys. I think they're fantastic. EDTA can chelate calcium, so I recommend when people are taking EDTA suppositories to supplement with additional calcium and magnesium to offset any loss that they may have taking the EDTA. So Marina, do you take binders during or after sauna session? So typically I'll have clients take binders once, sometimes twice a day, or just as needed. Some people like to take binders prior to doing detox protocols like saunas or coffee enemas. So you typically want to take the binder about 30 minutes before doing any kind of detox protocol. And that's going to help when you're doing a coffee enema. You get lots of bile, the toxins build up in the bile, and the binder will absorb and clean up that bile before the bile gets reabsorbed by the body and used for something else. So binders are best taken 30 minutes before a coffee enema or infrared sauna session. But my CitraCleanse, the modified citrus pectin, stays in your blood for 12 hours after consuming it. So if you've taken CitraCleanse within 12 hours of doing a coffee enema or sauna session, you're fine. You don't need to take it 30 minutes beforehand. But if you haven't taken any binder throughout the day, then you probably want to do one about 30 minutes at least before a sauna or an infrared sauna session. So Kathy, do binders also remove good minerals? They can. It depends on the binder. So some binders like charcoal are indiscriminate. Charcoal is very powerful. It's very effective, but it also removes metals as well as minerals. So charcoal is not something I recommend to take on a long-term basis. Every once in a while is fine. That's why I really like my CitraCleanse, because I find it doesn't detox or grab on and chelate minerals like other binders do. There's a bamboo binder called Takasemi that's really nice, that doesn't bind onto minerals so much. But yeah, unfortunately, when you're detoxing metals, because metals and minerals can occupy the same binding sites in the body, when you're removing metals, you can also be removing minerals. That's just the price you have to pay to detox. There's not much we can do about that. That's why when you're doing any kind of detox, I usually start people out on taking lots and lots of minerals, trace minerals and macro minerals like magnesium and zinc and selenium, in addition to trace minerals like I like Oceans Alive, because that has all the trace minerals in it that we need, eating lots and lots of sea salt. That's very critical component of detoxification and replacing any minerals that may be lost while you're doing a detox. So Kate, do chia seeds count as a binder? Yes. So chia seeds contain alganates, just like seaweeds, just like aloe vera. Those contain alganates that bind onto metals in our body. So they're very, very effective detox strategy. I love chia seeds. There's a kombucha that has chia seeds in it. They're all nice and slimy, and they're great. I love them. So they do count as a binder. They're not going to be the strongest binder out there. You probably want to take additional binders like my CitraCleanse or other types of binders. There's lots of great binders out there, but that's not in and of itself going to be enough to do a very, very effective metal detox. So Lisa, so do you recommend charcoal tabs as a binder? So I mentioned this earlier. I don't recommend it on an ongoing basis. You can probably take it for a week or take it, for a day here and there, but I don't like it long term because it's indiscriminate. It detoxes too many minerals. And so Grace, so how do you help a 10-year-old detox cadmium? So for that, for a child, I usually will want to start children on a Nest Health bioenergetic program because number one, it's really, really effective. Number two, it gets people feeling the best, the fastest. Number three, it's really, really easy for children to do. They essentially only have to drink a glass of water to do the treatment or to do the protocol for the bioenergetic program. But children can also take certain supplements, and I'll list off right now the best supplements to detox cadmium. There's a lot of different supplements that you can take. Number one is zinc. So you can give a child some zinc supplements. You don't want to take any more than 50 milligrams per day of zinc, because what happens is, so you have these zinc receptors in your cells, and if you take more than 50 milligrams, the receptors withdraw, and then you don't get any of the benefit of the zinc. So you have to be very careful if you're taking all different types of supplements to not, look at all the zinc content and all those different supplements and make sure you don't go over 50 milligrams. So usually for a child, you can give a child about 10 milligrams, and that's sufficient, and that will push cadmium out of the body slowly but surely. Give the child red meat, also a very rich source of zinc as well. Cilantro, so cilantro tinctures, or coriander seed oil, which is the seed of the cilantro plant, very effective at detoxing cadmium. EDTA suppositories, what we just mentioned. Not a huge fan of giving children suppositories. We don't want to scar children for life by giving them suppositories or making them do coffee enemas. I mean, sure, we know our children need to detox, but for children, they have very fast metabolisms, and I find that just taking oral supplements is enough for them to detox effectively. They detox much, much faster than adults, especially older adults in their 60s and 70s. So children detox very, very beautifully, very, very quickly. But I find bioenergetics and some gentle supplements are the best way to go about detoxing children. Also, for cadmium, the modified citrus pectin, again, incredibly effective at detoxing most metals. So my CitraCleanse, the reason I recommend it is because it's so effective at absorbing all different types of metals, hundreds of chemicals in the body and in the bloodstream and the intestines. So that's a very easy thing you can give, and it doesn't really have a taste. It kind of tastes like oatmeal. So you can hide it in hot chocolate or milk or any other type of warm liquid, and the child typically won't taste it. For a cadmium detox, also sodium R-lipoic acid, very, very effective at detoxing cadmium from the brain and the nervous system and fat. And curcumin is effective. That's the active ingredient in turmeric. Garlic, glutathione, liposomal glutathione, effective at detoxing cadmium. Selenium, so eating Brazil nuts, a couple Brazil nuts a day, or taking S-E-methylselenocysteine, which is the form of selenium that I recommend, is really the most effective. I've worked with thousands of clients, and I've given a lot of different forms of selenium, and I found that a lot really don't work. They don't raise selenium levels, but the S-E-methylselenocysteine does the job every time. I'm always surprised because I work with so many people and giving them selenium supplements, and just their selenium just never moved over 2, 3, 4, 5 hair tests. The selenium levels never went up even after years of taking selenium. But with the S-E-methylselenocysteine, very, very effective. I find that after a couple months of taking it, the selenium levels do go up. So I recommend that brand by Life Extension, or eating a couple Brazil nuts a day, best way to get your selenium. Vitamin C is also a great way to detox selenium. Taurine, which is a sulfur-containing amino acid, completely missing in the vegan and vegetarian diet, is also very effective at detoxing cadmium. And so those are the best supplements to detox cadmium. And any one of those you can give to a young child. And so the next question here. Saul, so glad you're talking about NEST. I know, don't you love NEST? Saul, you're a fellow functional diagnostic nutritionist, and I've done a lecture to all the FDNs, a couple of different lectures about NEST Health, and I've had a few functional diagnostic nutritionists do the NEST Health training. The word is really spreading about bioenergetics and how powerful it is. I truly think it's the future of medicine. It's the future of health. I've seen just unbelievable recoveries, unbelievable stories. I've had my own personal story of recovery physically and mentally with NEST Health, and I can't recommend it highly enough. And I really recommend anyone out there to learn more about it. I have a podcast on MyersDetox.com called Supercharge, specifically devoted to bioenergetics, and we have about 15 episodes right now. I recommend, if you're interested in learning more about NEST Health, listen to the one called What You See in a Bioenergetic Scan with Debbie Hart. There's a video you can watch. We take you through the whole process, the whole NEST Health bioenergetic process, getting a scan, what you see in a NEST Health scan, and how my scan correlated to my health symptoms at that time, all the things I was going through physically and mentally and emotionally. And it's just really, really fascinating process, and I highly recommend it. And so Belle, detoxing with IBS calotis, Meniere's, fatty liver, is that dangerous? So I don't think that it's dangerous to detox if you have multiple health diagnoses of those types. Coffee enemas are incredibly effective at improving fatty liver disease, of which millions of Americans suffer from. And people with IBS and colitis, while those can be emotional in nature, people can have anxiety or stress that can aggravate those conditions. Those can also be have a heavy metal or chemical underlying root cause. When people have multiple health diagnoses, I will typically recommend them do a NEST Health bioenergetic program, because I find that's the fastest way to resolve symptoms, resolve health issues, restore functioning, improve energy levels, improve sleep, improve the functioning of the detox organs. And that's the best way to prep the body before going into a heavy duty detox. You can certainly do something simple like my mitochondria detox, where you're taking a binder and you're taking a mild chelator, you're taking the BioSil as a chelator to grab onto some metals, and you can start doing some things. But more importantly, no matter where you are in the health spectrum, you have to do what works for your body. So you can start a detox, and if you find you're having too many symptoms, you really don't feel well, you're not functioning, that's a sign that it's not right for you at that time. But if you pull back and do something like the NEST Health bioenergetic program for a little while, 6 months, maybe 12 months, and then start the detox again, you may find that you're able to tolerate it much, much better. So again, it just there isn't any hard and fast rule. Everyone's very, very different, with different genetics, different health diagnoses. So you just really have to try and see where you're at and then course correct. And that's why it's really, really important to be working with a trained health coach in detoxification, like our Myers Detox Protocol practitioners, so that you have someone that can hold your hand, answer your questions, help you course correct. If you don't tolerate a supplement or you're having detox symptoms, you have someone right there coaching you through the whole process that can foresee all the different problems and help you through the whole detox process. So that's really what I recommend if you have multiple health issues, to work with a practitioner that can get you on that road to healing while doing a detox. So your YouTube channel showed your Myers cocktail. but you did not mention combining it with any binders. So should these be done together? So yes. So I have a video on how to make the Myers Detox cocktail on my YouTube channel, but I probably should have mentioned taking a binder. You always want to take a binder anytime you're doing any type of detox. So the Myers Detox cocktail, you do want to take that in conjunction with a binder. And can you advise how far apart the modified citrus pectin and, say, a drawing formula like BioSil, Cilantro, Zeolite should be taken away from each other and away from food? So generally, I recommend taking a binder about 30 minutes to 60 minutes prior to taking a chelator or drawing formula like you mentioned, like BioSil and Cilantro. So just think about an hour prior, 30 minutes to an hour prior minimum. So Misty, yes, I'm using Nest Health and Pharmaceuticals now, going on week 3. Had a hard detox reaction around day 3, day 7, but it's better now and feeling really good. So good for you. I'm happy to hear that. Some people, Nest Health can be a little bit rough in the beginning because their body really starts making a lot of changes, a lot of progress very, very quickly. And that was certainly my experience as well. I was really taken aback by how much change was happening within the first 30 days of starting a Nest Health program. And so for some people, it's rougher than others. I mean, I definitely had some insomnia. I had very, very vivid dreams and a lot of emotional detox happening when I started my Nest Health program. But I also had complete resolution of my lower back pain. I had a lot of other things happen, better energy, better mood, better sleep, after I had a few days of insomnia. And so people do have detox reactions, but it's just the body going through transition. And then at the other side of that, people tend to feel amazing afterwards. But, it's like anything with detox or Nest, it's going to be a little bit of a roller coaster. You'll have peaks and valleys, and times where you feel great, and times where you're detox, it feels so great. It's all just part of the program. So Ryan, I may do Nest, and I've been spending so much money on tests, supplements, treatments, and still feel lousy. And I hear you, because I have clients come to me. They've been to dozens of doctors, then they're done, or they realize the conventional mainstream medical system doesn't work. Then they turn to functional medicine, typically not covered by insurance. Then the functional medical doctors love to do all different kinds of tests, organic acid tests and genetic tests, and all these very, very expensive tests. And I've been there, done that. I used to, as a functional diagnostic nutritionist, I was doing all these tests with clients as well. And, I got to the point where after I started using Nest Health Bioenergetics and learning more about that and gone through the training a couple of times, I realized that it's the test that you do, the information you get is only good if you can act on it, if you can give something to someone to elicit a change in their body. And for many people, supplements are great. They're better than medications. And usually following a functional medical test, people will be given supplements. They'll be given a parasite protocol or something of that nature. But many times they're just informative. People just get information from these functional medical tests, and that's it. They've spent hundreds of dollars. Some of these tests are even $1,000 to do just one test, and they have to be repeated every 6 months or so. So it gets very, very prohibitively expensive for many people. And I found that with Nest Health, that people can get a lot of resolution of their symptoms, because the only reason you're doing these tests is you want to feel better, not because you want to do tests. You want to feel better. You want better sleep, better energy, better mood. That's all you're looking for. And Nest Health provides that, because I think it truly addresses the underlying root cause, which is just poor communication in the body. That's it. I mean, that's when you have poor communication in the body, your body isn't able to send operating instructions to various parts of your body because of heavy metals, chemicals, emotional trauma, scars, and EMF, whatever the case may be. Then you're going to have a physical breakdown in functioning. And when you remove these energetic blocks and you restore communication and function in your body, you have a resolution of the physical symptoms. And for me, I just found it was a much more elegant way to work. It was a much faster way to get people resolution of their symptoms. I found that it was more effective, less expensive. So for me, that's what I'm going to do first with people before I'm going to do all different kinds of expensive functional medical tests. So that's just my personal take in working with clients, and I just want to do what's most effective for people. I don't want to do all kinds of testing and take people's money. I want people to feel better and to do the things that are most effective. So in my own health journey, I vet things, and I found Ness. I vetted that for about 6 months. I tried it for 6 months before I recommended it to people. And I was completely blown away. And then I started doing it on my friends, my family, my dog, my daughter, my mother, all my family members. And I just continued to be wowed by it, and wowed by the high correlation of people's known health issues to the scan. And so that's really the place I want to start with people. And instead of doing all kinds of functional medical tests, I think it's just more effective. So that's enough about that. You guys have the point. So Eden, so how to detox autistic children. So with children, my favorite way to help them is with Ness Health Bioenergetics. There's amazing stories of dramatic improvement in autistic children using Ness Health. There's even a grandmother on YouTube that's documented the improvement of her autistic grandchild using Ness Health. So you can type in Ness Health and autism and grandmother, I believe, to find that video series. And so I find that's the best way, because Ness Health does help you to detox. It's not the complete picture. You also have to take binders to detox. Also, ionic foot baths are really incredibly effective with autistic children to help them detox. AMD, that makes the Ion Cleanse Ionic Foot Bath. They've got several studies with different populations of autistic children, teenage autistic children and younger children, younger populations of autistic children, and dramatic improvements, a 50% reduction in their symptoms after a year of using the Ion Foot Bath, the Ion Cleanse, and just dramatic recoveries doing that. So I think the Ion Foot Cleanse combined with binders, which are very simple to take, and with Ness Health, that's really how I think people are going to get the most dramatic results with their children. And the earlier you intervene with those protocols, the better. So Blaze, so right behind you, Misty Rushing. I'm in week 2 of Ness. Fortunately, I started a microbe formula, Carbon 1 and Carbon Plus binders the week before the Infoceuticals, so I don't have any detox reactions so far. So Blaze, so when you're taking binders don't actually affect the Infoceuticals in any way. So, and many people kind of may think that the minerals in the Infoceuticals are being absorbed by the binders, and then if that happens, then they don't get the most effective result with the Infoceuticals because perhaps they were absorbed. This actually is not the case. When you take the Infoceuticals, they get absorbed sublingually in your oral tissues, and they take effect very, very quickly. So a binder is not that you ingest is not going to affect the Infoceuticals and the operating instructions imprinted in the Infoceuticals in any way. So you don't have to worry about that. If you didn't have any detox reactions, that's totally fine. Not everyone is going to have detox reactions. It's in fact not the norm to have detox reactions when you begin a Ness Health program. So you're fine. If you don't feel anything within the first 7 to 10 days of starting a Ness Health program, taking the Infoceuticals, you may have to increase the drops that you're taking. So you may have to go from 9 to 15 drops or even 15 to 28 drops in order to elicit an effect and the change that you need. Usually 15 drops is enough for most people to get the change that they need, but very, very sensitive people need a lot less. So if you're not sensitive, you might need more of the drops. So Bridget, if we could stop the chemtrail heavy metal spraying, that would be awesome and helpful. I agree with you. Chemtrails are a huge, huge problem. The spraying of these chemtrails is putting aluminum and barium and strontium and other metals into our environment, which we then inhale and affect our bodies in various ways. And it's a huge problem. There's a lot of skeptics out there about the existence of chemtrails, and it seems kind of ridiculous to me, and there's so much evidence of chemtrails and of spraying and geoengineering. I mean, it's, there's Harvard people at Harvard they got the green light to do geoengineering. Metals and chemicals are being sprayed in our environment to elicit a change in the weather patterns. And we're also, when there's fires, there's chemicals sprayed on the fires. Like, say in California, we have wildfires. Get a lot of chemicals sprayed in the air to put out the fires, and people get very, very sick. They start having asthma. They start having a lot of nasal issues and congestion and things like that as a result. So chemtrails are very real and really a big contributor, especially to aluminum toxicity in our environment. So guys, I'm starting to lose my voice. So that's usually my cue to wrap things up. So I hope you guys enjoyed this week's Facebook Live, my weekly little show that I use to help educate you guys about the importance and power of detoxification, how it can dramatically improve and change your life. So please join me next week, next Tuesday at 5 p.m. Pacific, 8 p.m. Eastern, where I'll have another lecture regarding toxicity. I may have an interview. I think I'm doing an interview next week. Sometimes it's me just lecturing to you guys. Sometimes I'm doing an interview of a friend of mine that has very, very important information to help you reach your health goals. So thank you so much for joining, you guys, and I'll see you next week. So just remember, if any of you guys are not on Facebook, or if you have friends that you want to recommend this to that are not on Facebook, they can always just go on my YouTube channel and watch the replay. Usually it goes on my YouTube channel, the Facebook Live, the day after, a day or two after I actually do the Facebook Live. But you can always watch it at any time on the Myers Detox Facebook page. The Facebook Live is there forever, so you can watch it as many times as you need to if you missed anything or if you tuned in too late. So thank you guys so much for joining me. It's always a pleasure educating you guys about detox, and I'll see you next week.